Good evening, everyone, and welcome to today's session. Every day we plan to have around an hour of session discussing around 50 to 60 questions. The main idea is to add a bit tempo into your preparation, make you feel that teacher is also studying along with you. That is the main intention. The main idea is as a part of it, every day evening 6 p.m. we plan to have a session, but there's so many floods in Hyderabad, so power is very fluctuating. I pray that this session, this live session, we will not have any power issue leading to discontinuation. So tomorrow is Sunday. Every Sunday morning 9 a.m. to evening 5 p.m. Every hourly there is a quiz tournament. We divide the full-scale grant test of 300 questions into 10 quiz tournaments of 30 questions each. We will all play together, so that will keep you well charged, because a mock test is supposed to be concurrent live, where you are fighting with all your classmates. That moment I am waiting for from tomorrow onwards. And the remaining days, Monday to Saturday, every day, whenever possible, I come live and we will have a live online session, right? So that's the plan. So let's make the great beginning. Let's take up 50 questions, hot questions, and try to solve them. The sacred tuberous ligament. You can keep punching your answers and responses into the chat window, doctor. The sacred tuberous ligament is the degenerated tendon of which muscle? You can punch your answers into the chat window, please. So the sacred tuberous ligament is the degenerated tendon of the biceps femoris, is what you need to remember. So the sacred tuberous, as the name itself indicates, runs from the sacrum to the tuberosity of the ischium, Now, there is something called pudendal nerve entrapment syndrome, which you need to know. It is mainly secondary to the calcification of the sacred tuberous ligament. Is one of the favorite MCQs in the tomorrow's exam. Then, urogenital diaphragm. Even when we are all students of anatomy, layers of the soul. Oh my God. This used to be the deadliest topic, everything imagination only. Similarly, pelvic diaphragm is one topic that used to be a drudgery for us to remember, right? So, urogenital diaphragm, what are the things that are part of it, what penetrate it, what pass through it, what are contained in it, everything you should know. So it is the deep transverse perineal muscle, which is the muscle of the urogenital diaphragm, is what you need to remember. So urogenital diaphragm is that layer of the pelvis which separates the deep perineal sac from the upper pelvis. So you should remember, this is the abdominal cavity. This is the greater pelvis, and this is the lesser pelvis, this triangular shaped. And here you have the pelvic brim, and we are talking about the pelvic diaphragm is what you should remember. So this is the perineal membrane, the perineal body, the external anal sphincter, the urethral opening which is carrying the urine, and these are the structures and their alignment you need to be doubly sure about. Similarly, this is the sacrotuberous ligament, the ischial spine, and levator ani muscle, and this three-dimensional view and understanding of the perineal body, urogenital diaphragm is very, very important. So we discussed in a lot of videos in the onlinembbs.com very clearly about what are the constituents of superficial perineal pouch, deep perineal pouch, perineal membrane, urogenital body, etc., etc. So, doctor, what are the boundaries of the epiploic foramen? One of the favorite questions. Tomorrow, some of you are going to become surgical gastroenterologists, hepatobiliary surgeons. With that great dream, you should prepare for the entrance. So, you need to remember that the inferior vena cava, caudate process of the liver, first part of the duodenum, they are the boundaries of the epiploic foramen, is what you need to remember. So the epiploic foramen is bounded in front by the free border of the lesser omentum, and it has got common bile duct, hepatic artery, portal vein between these two layers. So if you look at the hepatoduodenal ligament, which is connecting the liver with the duodenum, the hepatoduodenal ligament. So what does it basically contain? It contains portal triad, epiploic foramen of Winslow, and epiploic foramen is the one that separates the left side lesser sac and the right side greater sac. Right में होता है greater sac, left में होता है lesser sac, and it is anterior to the IVC is what you have to remember. Now, what are the posterior relations of the cecum? So, the right iliacus, right lateral cutaneous nerve of thigh, right iliac branch of iliolumbar artery, they're all the posterior relationships of the cecum. Cecum is that widest part from which the appendix is hanging. It is the one which has a large diameter. That's the reason anywhere is the obstruction in the colon, all that pressure will be, the brunt will be borne by the cecum, is what you have to emphatically remember. Very good to see about 8 online classmates. Very good. So let me tell you, from now, October 16th to January 6th, we have around 75 days of time. Every day, you have a daily live session on this YouTube channel. Every day, there are 20 quiz tournaments of totally 400 MCQs on the Incus Quiz app. So you can go to the Android Play Store. There you can type Incus without space quiz. Without space quiz. You will be able to reach to the mobile app and you can be able to download. So, what are the posterior relations of the cecum is one of the favorite questions of the examiner. So, I leave this literature for you to do a revision. So, the cecum lies on the right iliacus, lateral cutaneous nerve of the thigh, and psoas major. That's what you should appreciate. So all anterior posterior relations of the cecum is a favorite question of the examiner. Now, with regard to the sarcoplasmic reticulum, what is true thing about it? Sarcoplasmic reticulum has calcium adipase pumps, and it has got rich energy sources, and it forms the triads where they come in contact with the T tubules is what you need to remember. So, nerve muscle physiology. What I want to once more tell you is the most important topic in focus is nerve muscle physiology. You got to be 100% sure about. So, the cell membranes in skeletal muscle. Typically, they show all these invaginations that contain the intracellular tubules which are involved in the excitation contraction coupling, which is mediated by the calcium release, is what you need to remember. So the T tubular system, the dihydropyridine channels, and the sarcoplasmic reticulum, the release of the calcium and how it basically coordinates the contraction, you need to be very sure. So very good to see Saurabh Kumar 007. Very good, very good. So recently, for the past 45 days, 6 weeks, I lost the habit of coming online. But now the examination season aa gaya. The time that the teacher and students together work with all the commitment, dedication, involvement, and then lead to a positive outcome in the upcoming January first week NEET PG exam. So let us work together. So once more, let me tell all of you, Incus Quiz Tournament app is our new innovation. So take every opportunity to download this app in the Android Play Store and try to play 20 quiz tournaments every day. 20 quiz tournaments every day is the goal, right? Every hourly there is a quiz tournament. Every Sunday we will make the grand test divided into around 10 tournaments or 30 questions each. Live you can have a fight with your classmates in a lively manner. Ventricular filling, basically ventricular gallop. Whenever the ventricle fails, you listen third heart sound. Whenever atria are trying to powerfully push the blood into a stiff ventricle, like a hypertensive, hypertrophic ventricle, that lead to development of S4. So fourth heart sound is called atrial gallop, whereas the third heart sound is called ventricular gallop, is what you need to remember. Now, whenever the blood is passing through the capillaries, through the venous circulation, there is an exchange of carbon dioxide. So in the RBCs, carbon dioxide is converted in the capillary blood into bicarbonate HCO3 minus. The HCO3 minus will move into the RBC, and against it, chloride will move into the capillary blood, and that is called chloride shift, is what you need to remember. Chloride shift is what you need to remember. So the chloride ion concentration in the red cells typically will increase, is what you need to remember. With regard to defecation as a reflex action, you all know that defecation is basically reflexively controlled by the sacral cord. Now, the efferent limb travels mainly in the sympathetic autonomic nerves, is wrong. Parasympathetic is right. Defecation can be voluntarily inhibited, facilitated. So they're all the true statements. लेफ्ट फुट का पेन को कहाँ रिपोर्टिंग होगा? लेफ्ट फुट का पेन का रिपोर्टिंग होता है right side of the thalamus, contralateral side thalamus. Thalamus is the center of the brain which receives all the sensory inputs From the thalamus, there is a relay that happens to the sensory cortex. That is what you need to appreciate. So, contralateral thalamus is what you need to remember. Now, what is the most common porphyria? You need to know Porphyria cutanea tarda is considered to be the most common porphyria. And Porphyria cutanea tarda is also called cutaneous hepatic porphyria. It is the most common porphyria. Both the skin is involved and liver is also involved in Porphyria cutanea tarda. So acute intermittent congenital erythropoietic Porphyria cutanea tarda, hereditary, variegate, and protoporphyria. So you have to be very sure on this topic of porphyrias, doctor. मैं आपको वचन देता हूँ. There are 953 high yield topics that we mentioned in the onlineMBBS.com video library. Please take every chance to quickly do the revision of this. अगर आप करें तो आप 1000+ स्कोर मारेगा आसानी से कल के नीट पीजी में. Right? It's very easy. You still have 75 days of time. Every day I promise to spend time with you to conduct the live session. You can inform your friends and you can bring more and more of them to this YouTube channel. Succinyl choline plus glycine aminolevulani, that gives rise to porphyrinogen. Then tetrapyrrole, uroporphyrinogen 3, corpoporphyrinogen 3, protoporphyrin 9, and ultimately heme. So the first enzyme, LR synthetase, LR dehydrase, they don't have any deficiencies. So acute intermittent porphyria is uroporphyrinogen 1 synthase. Congenital erythropoietic is 3 co-synthase. Porphyria cutanea tarda is 3 decarboxylase. Hereditary coproporphyria is coproporphyrinogen 3 oxidase. Variegate porphyria is protoporphyrinogen oxidase. And ferrochelatase is protoporphyria is what you need to remember. Now, where do you see hyperuricemia? Leishmanian, gout, and xanthine oxidase hyperactivity, all this will lead to development of hyperuricemia. Whereas carbamyl phosphate synthetase deficiency will lead to hyperammonemia, is what you have to remember. That's what urea cycle is one of the favorite areas of the examiner. Both purine pyrimidine में nitrogen atoms जो होता है, which is the one which is a contributor, is a very important question. Aspartate is the contributor. So the amino acid glycine is completely incorporated to provide C4, C5, and N7. Glutamine contributes N3, N9. Aspartate provides N1. So you have to be very sure on purine pyrimidine biosynthesis. If you have done this question wrong, you need to go back to onlineMBBS.com video library to do the revision. So carbamyl phosphate synthetase 1 is autosomal recessive. It is involved in urea cycle. It leads to hyperammonemia. The glutamine in the blood increases, blood urea nitrogen decreases, orotic acid and uracil are normal. So how do you differentiate the different enzymes of purine pyrimidine metabolism deficiencies? This is the most important table you have to master. Ek photo lena. Barabar? Now, what is that one defect responsible for gout? Is a very important question. One defect which is responsible for the gout. So, yeah, it is the PRPP synthetase deficiency which is responsible. PRPP synthetase catalyzes the first reaction in purine biosynthesis from ribose 5-phosphate. Generally, there is a feedback inhibition from the end product to this. So, if this inhibition is not there, then there is an overproduction and over-excretion of the catabolites of the purine metabolism, that is the uric acid, and that leads to development of the gout, is what you need to remember. With regard to vitamin A, it is a component of rhodopsin. So, the retinal pigment rhodopsin is composed of 11-cis retinol form of the vitamin A coupled to without any bite of a mite, only with the droplet transmission, which rickettsial disease it is. It is the Q fever is what you need to remember. It is the inhalation of the contaminated dust, aerosols, or ingestion of contaminated milk is responsible. Interleukin-1, it is a macrophage-derived product. All interleukins you should be sure, doctor. Interleukin-1, fever. Interleukin-2, T-cell stimulation. Interleukin-3, bone marrow stimulation. Interleukin-4 is IgE production. Interleukin-5 is IgA production. Interleukin-6 is acute phase reactant production. Interleukin-8 is neutrophil attraction. Interleukin-10 is stimulation of Th2. And interleukin-12 is NK cell activation is what you need to remember. Good to find Suhani Pathak after a long time. Good. A clinical diagnosis of meningitis is confirmed by the latex agglutination test on CSF. So which organism we are talking about? Cryptococcus. If you want to differentiate a specific parasitic agent, what is the best way? You need to study the distinctive morphology of the parasite. That's the only way. Now, for the cell-mediated immunity at the cellular level, what is primarily responsible for the specificity of cell-mediated immunity? Of the humoral immunity. It is the hypervariable region of the domains of the B cells bring that specificity is what you have to basically remember. Now, non-gonococcal urethritis. Good to see 9 online classmates. At least today we should touch 10 students. Once upon a time we used to have 300, 400 students on this Chai Pe Charcha. But last 2 months I lost the habit of coming alive because of various reasons. We were coming up technologically for a mobile app, and I was sitting with the developers to build the Incus quiz app. That was taking lots and lots of time. Now the app is ready. So we are going to get back to learning. Suhani Pathak, I'm so happy to listen that, sir, you came after a long time. I never miss any of your class. Thank you very much for that, Dr. Suhani Pathak. So good to see Balaji. Yeah. So from now onwards, we are going to have every day, because abhi exam ka season aa gaya, and we will try to have all that focus which is required, and that can only happen when both the students and teachers are studying together, right? Now, Ureaplasma ureolyticum. Now, isosort by dinite. Whenever you give to a patient, common complaint is throbbing headache because of that vasodilation. 70-year-old male is brought to emergency department after a syncopal episode. There is a second degree AV block. So which drug is known to lead to the depression of AV node, depression of the AV node, leading to AV nodal block? It is a calcium channel blocker, typically verapamil. Now, which antiarrhythmic, this is one of the favorite questions of the examiner, slows the phase 0 of the ventricular myocyte action potential and prolong the repolarization and refractory period? Is a very important question. Very good. Balaji rightly answers. It is disopyramide is what you need to remember. So this is how before drug and after drug, how the prolongation of the various phases occur. So remember, quinidine, procainamide, disopyramide are all class 1A antiarrhythmics. They block the slow phase 0 of the ventricular myocyte action potential. They prolong the repolarization as well as the refractory period of the cells. So this drug slowed the phase 0 depolarization and prolonged the phase 3 repolarization of the ventricular myocyte. So that's the reason it is diisopyramide, which is class 1A. Lidocaine hota hai class 1B. It has a very little effect on phase 0, but it shortens the phase 3 and the action potential duration. Propranolol is a beta blocker. It slows the conduction through the AV node and it prolongs the phase 4 depolarization. Diltiazem is a calcium channel blocker and a class 4 antiarrhythmic drug. It also acts on AV node. And speciality of diltiazem is only the rapidly depolarizing cells only in a use-dependent manner it lead to the blockade. It has no effect on ventricular myocyte action potential. Class 1C, it slows down the sodium-mediated phase 0 depolarization. So this is how the various antiarrhythmics basically function. So you can remember, what are the antiarrhythmics for the AV nodes? Drugs block AV. Drugs, digoxin. Block, beta blocker, AV, adenosine, verapamil. They are the 4 drugs that typically block AV node, is what you need to remember. No bad boys keeps clean. Easy to remember. No is sodium channel blockers are class 1. Bad boy is beta blockers class 2. Keeps is potassium channel blockers class 3. Clean is calcium channel blockers, which are class 4. Individual drugs के लिए कोई mnemonic है क्या? Police department questions the lady model for erotic pictures. Police department questions. Procainamide, disopyramide, quinidine, class 1A, not commonly used. The lady model, tocainide, lidocaine, vixilitin, class 1B, most commonly used. For erotic pictures, flecainide, encainide, propafenone, class 1C. That's what you need to remember. In a patient who has a severely impaired left ventricular function, if you give IV digoxin, it increases the cardiac output and decreases the right atrial pressure and pulmonary capillary blood pressure. But how does digoxin basically function? You all know it decreases the sodium efflux, which is considered to be the mechanism. because it is the inhibitor of sodium potassium ATPase in the cardiac pacemakers, leading to AV nodal blockade. It increases the diastolic filling time, and Frank Starling said the more the filling, the greater will be the contractile force. That's how it increases the contractility, is what you need to remember. So everything, anything about decoction, you have to get ready for tomorrow's NEET PG exam, doctor. Whenever there is a heparin-induced thrombocytopenia, you treat with ergothrombin. Ergothrombin. What is the mechanism of action of ergothrombin? Ergothrombin directly binds with the thrombin active site. See, अगर आप heparin दिए तो how does it achieve the anti-thrombotic function? Heparin will make anti-thrombin activated. Anti-thrombin will go and inhibit the thrombin. So directly it is not doing that. Whereas ergothrombin होता है direct thrombin inhibitor is what you have to remember. So the heparin-induced thrombocytopenia is treated with the direct thrombin inhibitors like ergothrombin is what you need to remember. So this is very important. Pyridine, lepidolin, ergothrombin, these are all direct thrombin inhibitors. With regard to colchicine, what is true? You can use colchicine for prophylaxis. You can use it in acute gouty arthritis, but don't use allopurinol, cannot be used. Allopurinol cannot be used, but colchicine can be used. Colchicine inhibits the microtubular polymerization, is what you have to basically remember. And colchicine, one of the important contraindication, don't forget, renal dysfunction, don't use colchicine. Now, primary biliary cirrhosis, primary sclerosing cholangitis. You should know the differences. Primary biliary cirrhosis can occur in patients who have ulcerative colitis. It is a rare autoimmune disease, mostly in the middle-aged women, with the destruction of the bile duct tubes and the triads of the liver. Anti-mitochondrial antibodies are found in middle-aged person, and intense chronic inflammatory infiltrates in the bile duct tubes. That's what you come across, and it leads to micronodular cirrhosis. Whereas sclerosing cholangitis, they will have inflammatory bowel disease, and primary biliary cirrhosis, more commonly in the asymptomatic females with pruritus, jaundice, and fatigue, is what you have to remember. What is a contributor for the elastic nature of an articular cartilage? It is the proteoglycans which are the contributors. So that is the reason in elderly people, when they come to your OPD, you try to give them medications that will enrich the proteoglycans to take care of the arthritis. 48-year-old male, excessive drinking, alcoholic hepatitis. Typically, what is that? You will find inside the liver. It is the pre-keratin intermediate filaments. Pre-keratin intermediate filaments. So all that hyaline is used for any material which is inside or outside the cell. It is red homogeneous. It stains with hematoxylin eosin. So when we talk alcoholic hyaline inclusions, they are called Mallory's bodies. They are irregular eosinophilic hyaline inclusions in the cytoplasm of the hepatocytes. And they contain pre-keratin intermediate filaments, is what you need to remember. Carcinoma of the esophagus. Most of the carcinomas, typically in the middle of the esophagus, they are all squamous. Squamous arise from the always, in situ lesion, tomorrow becomes squamous carcinoma. And those who have Barrett's esophagus, they develop adenocarcinoma. So what are the predisposing factors for the carcinoma? Smoking, esophagitis, achalasia, etc., etc. Now, doctor, in respiratory distress syndrome, all that excessive oxygen you are pushing, oxygen is called a poison sometimes when given as a drug. So you have to be careful. It leads to development of bronchopulmonary dysplasia. Now, ovarian cancer. For ovarian cancer, first of all, ovary should get exposed to carcinogens. For that, there should be a breach on the surface of ovary. That typically happen, in case of OCPs, when there is a anovulation, there is no breach at all. So OCPs indirectly will decrease the risk of developing ovarian cancer. So nulliparity, family history of ovarian, colon, breast cancer, any gonadal dysgenesis like Turner, high fat, low fiber diet, late menopause, they're all considered to be the risk factors. So what are the contraindications of gastric lavage and where can you do, which is not a, where is the indication? Favorite question of the examiner. In inorganic acids, H2SO4, HNO3, HCl, HF, gastric lavage is contraindicated. Whereas in organic acid poisoning, like aspirin, oxalic acid, carbolic acid, picric acid, acetic acid, tartaric acid, you can very much do the gastric lavage is what you need to remember. So whenever somebody took a bunch of pills of barbiturates, how are you going to manage? Alkalinization of urine. So how do you approach a patient who took all those sedative tablets of barbiturates? Give gastric lavage, ABC, forced alkaline diuresis. Very good to see Madhuri. So once more, I'm happy to see all our past students who used to be regular connoisseurs of this program. Please do come because the teacher is going to come regularly from now onwards. Please tell your friends also. And don't forget to download Incus Quiz Tournamenting app. Tomorrow Sunday test, we created 10 grand tests. 10 quiz tournaments, I mean to say. The 300 MCQ full-scale grand test is divided to 10 quiz tournaments and uploaded into the quiz tournament app. Try to play concurrently with your friends and see how your performance is. Right? So that is very important. So I will take also an opportunity to carry on discussion of some of the quiz tournament episodes live. But otherwise, it is like you can simply download the Incus Quiz app and can start playing, right? So the whole idea of the Incus Quiz app is every day 20 quiz tournaments, 400 questions practice, and covering of all 19 subjects. After the tournament is over, we move it into the history, and there you can do the revision of the questions. So that is what you need to do, right? So that keeps you inspired every moment, every day, every minute on the Incus Quiz app. So I want to see all of you to download the Incus Quiz app and then start playing the quiz tournaments every hour, every 1 hour, starting from morning 8 a.m. to night 12:30 p.m. Hemodialysis, hemoperfusion, they're all done in barbiturate poisoning. What type of respiration do you see in morphine poisoning? It is a slow respiration. Morphine depresses the respiratory center in a dose-dependent manner. Both the rate and tidal volume, both of them are decreased. If there is a rounded nasal opening, horseshoe-shaped palate, round orbit, cephalic index above 80, what type of race it is? It is Mongolian race. So based on the cephalic index, Negroes, blacks, they have 70 to 74.9, Mongols 80 or above, Europeans 75 to 79.9. The palate is rectangular in blacks, triangular in Europeans, rounded or horseshoe shaped in case of the Mongols is what you need to remember. Whenever there is any firearm injury, the entry wound blackening, why does it happen? Because all that smoke will lead to the tattooing is what you need to remember. Who introduced the concept of relation of environment and human health? Hippocrates. Air, waters and places. So ideal health indicators should be sensitive, specific and relevant. Prevalence is best studied by a cross-sectional study, which is like taking a photograph and having a panoramic view. To measure and evaluate the standard of therapy, we use survival rate. So in conditions like hepatitis B, if you are giving a live vaccine immunoglobulin, what should be the difference of time between the two? It should be 2 weeks of time between live vaccine and the immunoglobulins. Immunoglobulin should not be given within 2 weeks of administration of live vaccine is what you need to remember. Early detection and the diagnosis by the screening method. What is that basically called? That's called the lead time. If you are using any diagnostic investigation, the time, extra time that it offered for you is called the lead time. Carriers are important in maintaining the chain of transmission. In which case? In polio, typhoid, diphtheria, but not in measles. Not in measles. The only source of infection in measles is a case of measles, is what you need to remember. So what did WHO indicate for prevention of heart disease? WHO said, reduce the fat intake to 20 to 30% of caloric intake, reduction of cholesterol to below 100 milligram per 1000 kilocalories per day, decrease the salt intake to 5 grams per day or less. They are all the recommendations which you need to remember. So vegetable, fruits, whole grains, legumes, it is all recommended. So what is the ideal contraceptive? Ideal contraceptive should be safe, inexpensive, independent of coitus and does not require frequent administration. That's where all these intradermal formulations have come. Now, what are the developmental milestones? Please don't forget. Definitely aane wala question hota hai developmental milestones. The kid can sit without support at 6 months, walks backward in 15 months, walk up and down the stairs without the help at 24 months of age. And a 2-month-old child can hold his head in the midline. So that's the point. So now what are the essential fatty acids? Linoleic, linolenic and arachidonic are called essential fatty acids. Agricultural, industrial society. It is the occupation, environment, social mobility, which are all the differentiators. We will continue our discussion. So, every day, we all meet, discuss 50 to 60 questions. Chai pe charcha. Typically at 6 p.m., 7 p.m. anytime in the evening. And every day there are 20 quiz tournaments starting from 8 a.m. anatomy, 9 a.m. physiology, 20 questions. You can play with all the friends across the country. Download the Incus Quiz app, take a monthly subscription, buy a monthly subscription, and then you can start playing. Then on every Sunday, full-scale grand test of 300 questions is divided into 30 questions, 10 games, 10 quiz tournaments, and made available on every Sunday, morning 9 a.m. to evening 5. And we will also have a live discussion, right? So don't forget, go to the Google Play Store, get the Incus Quiz app, and then start playing the quiz tournaments for the NEET PG. Till then, good night and study well. Thank you.